Welcome to This Explainer. Today, we are diving into the incredibly frustrating world of fluctuating ear pressure. From the sheer everyday annoyance of a clogged ear that just absolutely won't pop, all the way to the downright alarming sensation of hearing your own heartbeat echoing inside your head. If you have ever dealt with this, you know exactly how maddening it can be. So, you might be wondering, why does my ear feel completely full? Or why can I suddenly hear my own breathing, especially right after losing weight? Listen, if you've recently dropped a significant amount of weight and suddenly feel like you're trapped underwater, or you're hearing your pulse echo in your skull, you are definitely not alone. It's a surprisingly common, yet rarely talked about phenomenon. Here is a quick roadmap for this explainer. We're going to start with that startling weight loss connection, dive into the actual mechanics of your ear pressure, go over some safe at-home relief maneuvers, talk about medical management and warnings, and finally look at advanced treatments and surgery. All right, section 1, the weight loss connection. Let's look at when shedding pounds actually impacts your ears. A really fascinating medical term to get familiar with here is autophony. This is a super jarring symptom of a patulous eustachian tube. And patulous basically just means the tube is abnormally stuck open. When this happens, the sounds of your own body, like your voice, your breathing, your heartbeat, are unnervingly amplified straight into your inner ear. It is wild. This brings us to a really interesting clinical case study published in Frontiers. It examined a 48-year-old woman who developed persistent autophony right after losing a huge amount of weight following a sleeve gastrectomy. She was suddenly hearing her own chewing and breathing so loudly, it was literally disrupting her entire life. So what was the hidden culprit? Well, it turns out rapid weight loss depletes something called Osman's fat pad. This is a tiny, localized little mass of fatty tissue that normally acts as a physiological valve. It keeps the eustachian tube comfortably closed at rest. When you lose that fat rapidly, that door basically just gets stuck wide open. Moving right along to section 2, the anatomy of ear pressure and understanding the eustachian tube. As outlined by NHS Tayside, your eustachian tube is a narrow little passage running from the middle ear to the back of the throat. Its main job? Equalizing air pressure so your eardrums can vibrate properly to process sound. It's actually supposed to be closed, only opening for a split second when you swallow, yawn, or chew. Now, a crucial distinction we really have to make here is understanding obstructive dysfunction versus patulous dysfunction. With obstructive dysfunction, the tubes are blocked tight by inflammation. Think colds, allergies, or smoking. But on the flip side, we have patulous dysfunction, where the tubes are stuck completely open, often caused by that severe weight loss or tissue depletion we just talked about. As you can probably guess, the treatment for one will absolutely not work for the other. Let's get into section 3, safe at-home relief maneuvers, how to pop your ears safely. For a blocked tube, the Cleveland Clinic recommends starting with the Valsalva maneuver. It's a really safe step-by-step way to force air into those blocked tubes. You just close your mouth, pinch your nostrils closed, and breathe out forcefully but gently. Kind of like blowing up a balloon, but directing the air into your ears. Just make sure you're sitting down first because this can sometimes make you feel a little dizzy. Now, if forcing air in doesn't give you relief, you can try the Toynbee maneuver. This takes the exact opposite approach. You close your mouth, pinch your nostrils, and swallow. So instead of pushing air up, you're utilizing your throat muscles to pull the tubes open and let the air equalize naturally. On top of that, simple everyday tactics can honestly work wonders. A big, convincing yawn physically stretches the muscles opening the tube. Chewing gum or sour candies creates saliva, which naturally prompts you to swallow repeatedly. And, as many TMJ sufferers will tell you, utilizing a heating pad for jaw and neck tension or just practicing proper tongue posture can drastically ease that ear fullness related to muscular tightness radiating up into the ear. Okay, section 4, medical management and warnings. Let's talk about when it's time to actually see a doctor. So, for obstructive issues caused by a really stubborn cold or allergies, over-the-counter anti-inflammatories and antihistamines are great first steps. Decongestant nasal sprays can also rapidly reduce swelling. However, and please heed this warning carefully, never ever use medicated decongestant sprays for more than 5 to 7 days. Overuse causes rebound congestion, which is going to make your blockage much, much worse. For chronic issues, your doctor might step in with a prescription steroid nasal spray to manage that long-term inflammation safely. And this part is absolutely critical. If you experience red flags like sharp pain, any fluid discharge, severe dizziness, or sudden hearing loss and constant ringing, which is known as tinnitus, it is time to see a doctor immediately. These aren't just signs of a clogged tube anymore. They could indicate much more serious conditions, like an inner ear infection or Meniere's disease, which involves dangerous fluid buildup deep inside the inner ear labyrinth. Let's wrap up with Section 5, Advanced Treatments and Surgery. What happens when we have to go beyond medications? For really persistent obstructive blockages, specialists might turn to balloon Eustachian tuboplasty, or BET for short. It's a highly effective, minimally invasive procedure for both adults and kids, where a tiny balloon catheter is actually inserted into the cartilaginous part of the tube to safely dilate it and get that natural pressure regulation working again. What is just so fascinating about this procedure is the exact surgical precision involved. Once the catheter is perfectly positioned, the balloon is inflated to exactly 10 bar of pressure for exactly 2 minutes. This meticulous expansion physically widens that chronically blocked tube without doing any damage to the super delicate surrounding tissues. As we can see when breaking down the treatments, they differ vastly based on the root cause. This proves exactly why getting the right diagnosis is crucial for your healing. A blocked tube gets dilated with a balloon or ventilation tubes, but a patchless, open tube gets plumped up with fat injections. And inner ear issues like Meniere's disease, those might require entirely different surgeries altogether, like endolymphatic sac decompression. Going back to our post-bariatric patient case study with the widely opened tubes, her doctors actually noticed something remarkable. Her frightening symptoms fluctuated based on a very specific weight threshold. Whenever she weighed over 80 kilograms, she felt totally fine. But the moment she dropped under 80 kilograms, that echoing autophony came rushing right back. Ultimately, to fix her persistently open tube and give her relief regardless of her weight, the surgeons had to get a little creative. They cleverly harvested fat from her thigh via liposuction, mixed it with platelet-rich plasma, and injected it directly into the lining of her Eustachian tube. This literally rebuilt the missing Osman's fat pad, finally closing that stuck door. So what's the big takeaway from this explainer? Well, our bodies are incredibly intricate, interconnected ecosystems. The next time your ears feel stubbornly clogged or you hear that strange echoing pulse, ask yourself, is it just a common cold? Or is your body trying to tell you a much bigger story about your stress levels, your allergies, or a recent change in your weight? Pay close attention to those signals. What other mysterious daily symptoms might actually be linked to a recent change in your life?